Can you tell me more about the exercise that you do to try and?
Okay, if you want to know about something, this is something. Because I want to be healthy, so I usually run every morning for 20 minutes, and later I do my video exercise for half an hour, and usually I go for a cycle in the evening for half an hour going up the hill.
And have you found you've had less energy than normal more recently?
No, I feel it means I don't have time for anything else, but I feel absolutely good. So, I just need to lose more weight. It's
How do you feel in yourself in terms of your mood?
I feel, maybe I would do with more energy, but otherwise I feel fine.
And other than your mother, is anyone else worried about you?
But people say the same, and I think they simply try to be nice to me, so I don't listen to them. But yes, other family members and my friends are saying that. I just don't talk to them, and I follow my own agenda. That's it.
Do you feel like you have been having less contact with your family and friends as a result of your eating?
Yeah, because they are nagging me, and apart from that, it makes me very busy because I'm following my diet and exercise, so it makes me a bit busy.
Has that had an impact on school or work?
School is, I concentrate on school, so I'm doing everything what I need, and I don't have any other activities, and I'm less interested in seeing friends. Or maybe ask me about my current weight. Or
what is your current weight at the moment?
It means I don't weigh myself, but why do you want to know all of that? So,
because we have normal ranges within which we are not concerned about people's weight or their.
But don't you think it's a private matter? Everybody's nagging me about it. So okay, if you have to know, at the moment I weigh 33 kilograms.
And what's your height?
161.
And are you happy at that current weight?
No, I'm not happy because I was happy because this was my target, but now I've got a different target because I think it's still too much. So I'm losing yet another maybe a kilogram or 2 kilograms.
Are you seeking out alternative methods to try and lose further weight in addition to the exercise and the restricting food intake?
Such as what?
Have you ever purged or vomited after eating?
It means I feel bloated when I eat my meals. So that's very private, and I'm not very proud of that. But yes, I try to vomit, and it does happen sometimes. It happens when my mother eventually, after all this nagging, makes me to eat a family meal, and I do vomit after that. So yes, it does happen. I suppose maybe that would be the end of it. Yes. Okay. Did you hear that? And did you hear this online people online? So what do you think? Do you think it would be a good interview for symptoms of anorexia? Yes, I think it would be definitely a pass. But what would the common things which came across interviewing me, that I'm lacking insight, I don't want anything to do with you, and I'm usually pressurized by somebody else coming or seeking medical advice. It rarely happens that anorexia, let's say at later stages, they may go through from this pre-contemplative side stage to contemplative stage, and it does happen that they seek help, but in most of the cases they are dismissive, they are difficult, they are insightless, and they are. But what was so striking? I think it was very good. Holly went through my intake, and I think that's the key issue, because if you forget about patients' intake, no matter how much time you've got and how difficult is the patient, you have to ask them roughly what they are taking on a daily basis. Yes, and from what you could hear, I'm not eating more than 500 or maybe 700 calories. With 700 calories and the level of exercise plus occasional vomit and all the rest of that, definitely I'm losing weight. Yes, so so you've got to have a rough idea how much the patient is weighing, and you asked, maybe with a bit of prompting, but you asked about the exercise, and you asked about other behaviors designed to lose weight. There is a problem. What I was trying to say was that people with anorexia nervosa, usually they are incredibly concrete and incredibly pedantic about what they eat. So something like that, operating half an apple, half a potato, and it doesn't divert. They don't eat with other people. They eat in isolation. They count calories, and they are restricting their diet. The main idea behind it is that anorexia nervosa, it's past the stage of satisfying the hunger. They are taking food in a prescriptive way. So in normal circumstances, evolution created us the way that we eat because we satisfy our hunger. And if you ask them, for example, whether they are hungry, they will say no. And I suppose you asked a very typical question, whether I would be worried about my weight. Again, I would say the typical patient of anorexia, they are not worried. Everybody is worried, and they are saying, I'm eating regular meals, I'm eating variety of food, and for me it's right, and this is how it should be. So the most common mistake people make assessing anorexia, so let's say GPs are making inquiries. What are the two questions that GP ask assessing for anorexia, or what are the most typical two questions people ask about anorexia without having any knowledge about the condition, which failed them to recognize? What do you think? They ask a question. They ask the question whether the patient believes that they eat adequately and normally. Yes, and the answer for that is yes, which is a false negative, obviously. So if your interview for anorexia nervosa stops at that stage, you cannot conclude, because typically they wouldn't be saying anything. And the second question very often is being asked, which is, do you feel hungry? And patients with anorexia nervosa will typically say, no, I'm not hungry, because the essence of the illness is that they don't follow their hunger. It means that when they recover from anorexia nervosa, they say, yes, I was feeling tremendously hungry, but I didn't respond to my hunger. I was just the control over my diet and losing weight and all those targets and counting calories, examining food labels, and exercising is so consuming that there is no room for any hunger. Okay, and you asked about purging. If there is a bit of purging, which is happening in about 10, maybe 20% of initial presentations of anorexia nervosa. In more advanced cases, it would be about 50%, but it's not the most common scenario. And if it is the case, it comes to a slightly different category. It's a non-restrictive anorexia nervosa. Restrictive anorexia nervosa is only with
dieting, exercising, avoiding special calories, particular foods and carbohydrates. Okay, so maybe we'll stop here. Do you have any comments about the OSCE? What else? Because you know, the other thing is, if you do your OSCE, if you've got enough time, you can ask about mood, you can ask about family history or something like that. But the anorexia is a nice OSCE in psychiatry, because it's easy to rate people, and it's easy to find out. It's easy to say whether they passed or not, because you have to have an idea about the intake, food intake, and you have to have an idea about current weight, and you have to have an idea about basic anorexic behaviors, means vomiting, exercising and vomiting first. But I suppose something like that would be a pass. Don't forget about making inquiries about the weight. Don't and do remember that you will be, more often than not, you will be dismissed by the patient. They don't want to talk to you. They think that this is the private matter, and so on. So I suppose I acted as a typical patient with anorexia nervosa A&E first presentation. And very important, what is important to remember is don't ask, or if you do ask questions which you know the answer is no for, it doesn't take you any further. You have to explore further. So that's why I'm saying once again that the most typical scenario is that those people, the illness goes on untreated for very often months, if not years, on the basis that they won't raise the problem, and they will give you false negatives to the most typical questions about appetite and eating. If you ask them, are you eating normally? Yes, of course. You have to ask what you eat. And I want to present one patient which is really shocking, I suppose. Can you hear this? Yes. So this was one of my patients, and we can. I don't know why, but Ehlers-Danlos happens so often, and it's associated with psychopathology, psychiatric psychopathology. But nevertheless, and so she was 29 with Ehlers-Danlos, which made it very difficult because anorexic symptoms, as you will see in a minute, were hidden behind her physical symptomatology, which I believe wasn't prominent. And she was diagnosed with anorexia at the age of 12. Do you think it's what's the most common, the onset of anorexia nervosa? What do you think? Sorry? No, I suppose that would be slightly too early, but it's getting more complicated because the age, the prevalence of anorexia nervosa is definitely increasing. We don't know whether it's because the cases are better detected, or I personally believe that the incidence is higher. But 10 or 11 would be too early. The most typical would be something like 16, 17. The peak of first presentation would be, if you take into account that usually the symptoms are there for sometimes 12 months, 2 years, something like that. So it takes us to the average age of onset about 14, 15, but coming to the presentation, coming to the attention of the services slightly late. So she was diagnosed very early, and the rest wouldn't matter. So this is what she was doing. Ongoing dieting, and dieting is usually started in the context. What did I say about how it started with myself? Do you remember? What did I say when you asked me when did you start dieting? How it started? I said that I was overweight before, and about 70–80% of cases, it's being overweight before. Not every single case, but overweight before, slightly on a bigger size, and dieting. And this dieting goes on, becomes out of proportion, very consuming. We can skip the rest of that. So ongoing issues were when she came to my attention. She was she weighed 27 kilograms, and I suppose she was probably the lowest ever BMI I have ever come across, because she was under 10. She was at home. She had pressure sores. She was in bed, not doing anything, and the family were prepared for her death. And she was she had one son, but nevertheless she was encouraged to make a will. I went to see her at home, and the shocking thing was that the feeding she received was via NG, and it was a TPN, and TPN feed was about 2,000 calories, came from London. It was only in Eastbourne, but I came from London every third day, from Royal London Hospital. It's not her picture, by the way, but came from Royal London Hospital, and she had a pump. The feed was administered at home with no supervision. So she was technically consuming, or not consuming, she was technically receiving 2,000 calories. There was no digestion because it was intravenous, so you deduct something like 10 or 20% of the feed, which is normally wasted for digestion. So she was having appropriate feed for her age, and she was still drastically losing weight. And when if you ask me about the interview she gave me, it would be very different to the interview I gave to you, because her interview with me would qualify for a parliament speech of somebody who could not possibly, in any circumstances, had anorexia nervosa. So she was denying all possible symptoms and all possible symptomatology, and denying ever dieting or anything like that. And I've been doing the job for far too long. If not to know that if the interview is too good and they volunteer enough information without even being asked, it means that there is a problem underneath. And apart from that, a simple physiology, you cannot be receiving 2,000 calories intravenously and losing weight, being 27 kilograms. So I left the interview and said to her mother that I'm not accusing anybody. So this is what the situation was. No, her BMI was above 10, but nevertheless she was losing weight with her pressure sores and severely limited mobility. And I told her mother that I'm not accusing anybody, but there must be something not right. And anorexia comes with a lot of tricks and an enormous amount of deception, which you as doctors, you have to be prepared for. That anorexia, they will be trying everything in their power to satisfy your anxiety and to divert you from the most common cause of losing weight, which is not enough food. And I said something to her mother, maybe we can bring the pump, or maybe you can visit her at night. And let's skip this. So the mother once went to her room at night, and the pump with TPN food was feeding the toilet. So she disconnected that from herself and was bypassing it to the toilet. So she had 75% of the feed, which I believe was her statement. So maybe she was mistaken, but I estimate that out of this 2,000 calories, she must have had something like 20%, maybe 25%, which would explain losing weight. Because the simple calculation is that if you've got a patient without any exercise, without any exercise, without any other ways of spending calories, if they eat less than, on average, less than 700 calories per day, they will be losing weight, because maintaining temperature and metabolism and all the other basic functions requires something like 1,200 calories. Even if you slow down metabolism, they are typically hypothermic, bradycardic, and they don't menstruate, all of that. But nevertheless, even if you shut down all the systems as much as possible, if you eat 700 calories, you are losing weight. Or you may come to the point after, let's say, 3 or 5 years of anorexia nervosa, that 700 calories maintains your weight with a maximal shutting down all possible systems. So she was disposing 75% of the feed, and we were keeping her at home at that stage, trying to impose supervision over her TPN and oral feeding regimen. She wasn't taking anything orally because she said that she couldn't digest because of her gastroparesis, which I believe was not quite the point. I think having TPN food and the pump and gave her perfect control over what she's eating. But I'm presenting the case to show that, because the title is Power of Anorexia Nervosa, and this is the illness which will come with so much deception. I have to be honest, I have never come across this level of deception, but this is the illness which will come with an enormous amount of deception, especially at later stages, with all possible tricks. I could exemplify that, and it will come with a terrible, enormous amount of persuasion to somehow settle your anxieties and to divert your thinking from anorexia nervosa. And but at the same time, it comes with this very strong conviction that they look good, they feel good, and this is what they should be doing, and there is nothing wrong with it. In your line of inquiry, Holly, what was there else in terms of her cognition or her thinking, which I volunteered of my own accord? So lack of insight, I'm just speaking, repeating what Holly said. So lack of insight and say that. Yeah, so lack of insight, but how about her body? What did I say about my body? Yes, and what was I doing showing my body? Yes, so I had, in other words, body image distortions. Yes, and this is very typical for anorexia, that they will be saying that they still need to lose weight, and they are setting one target after the other. That's very typical. That premorbidly they may be slightly overweight, it comes to the stage when they are dieting, they beforehand they would be satisfied, let's say, with 45 kilograms. When 45 comes, they are saying, no, they are too fat, and I want 42. And after 42, there is yet another target. The other thing to remember about anorexia is, and I really want you to if you forget about all of that, please do remember that there is this element in anorexia which is self-perpetuating. It means very often, the more they lose weight, the more underweight they become, the stronger the conviction that they are still overweight. And it's very difficult to explain that, but we believe that perhaps the state of malnutrition and being consumed by all of that is driving them further to make further sacrifices. So in other words, if you see somebody and they are saying, no, please, doctor, please let me diet, and I'll be fine when I'm 42. You are saying, you should be saying, you shouldn't be colluding with that, and you shouldn't be agreeing with that, because the likelihood is that 42 won't be good enough, because there will be another target, and that's why what we do in the first place, it's easy to say that the treatment for anorexia nervosa is food, and it's refeeding. And each time they take food, it's not only the nutrition, but also an element of cognitive persuasion and cognitive therapy, because anorexia is what? Phobia of food, and you overcome phobia of anything by providing the object or delivering the object, which is being they are phobic about. Okay, so eventually she was this patient, obviously she didn't give up easily, and you can imagine that there was a lot of commotion, because there were a lot of doctors involved, but you would be thinking those physicians from Royal London Hospital, knowing all of that, they would be each of us would be thinking, physiologically it doesn't make sense. 2,000 calories and her weight, it doesn't make sense. So they were trying to increase the amount of TPN food, not somehow not realizing that she was disposing it. But if something like that happens, you mustn't listen to the patient. You mustn't collude with the patient. You mustn't. You just have to use logic, and at the same time, the best way of thinking about it is, I'm not accusing you, I'm accusing anorexia, because this is what anorexia makes you to behave or to do. But you can imagine that yet another few months and she would probably be dead. So we were trying to increase the amount of TPN food. Obviously, there's this refeeding syndrome and all the rest of that. So I won't bore you with that, but it was under control. And she found ingenious ways of deceiving us. There were hidden bottles, and the tubes were going to feeding bottles, and when she was not watched, she was disconnecting them and all the rest of that, so there was less control, and we were playing this game for quite some time until she had to be admitted to hospital. And she had to be admitted to hospital under Section 3. She came to A&E here. I can't remember whose care she was under, but the consultant in A&E decided that I'm not taking any of this TP, and it was the right decision. I'm not taking, and let's see how she goes on with oral food. And she was feeding, she was just digesting normally, which means that you can imagine the cost and the involvement. She was on 80 months. She was on TPN food, specially delivered from Royal London Hospital. And apart from that, it was all wasted, going to the toilet. but it exemplifies how severe the state of cognition and conviction about anorexia was. Anyway, she had eventually few admissions, and now she's doing well. So that's the one I wanted to show. I don't know whether the other one is available.
I can see if I can share it for you. Can you see the presentation? Can Dr. Griginski see it?
Possibly hear me online. We've got Fatma, and the scenario is that you have to speak up. Maybe you can take off the mask for this occasion. Yes. So the scenario is that I'm coming to A&E. My family is concerned about. They suspect that I may be vomiting and not eating meals with them. And I became very isolated and losing weight. So, come on.
Hi, I'm Fatma, one of the junior doctors in the A&E. So, how can I help you today, my dear?
Oh, you don't need to help me because I don't need any help. I'm perfectly fine. And it was, again, my parents and my brother who brought me here, but I don't need your help.
Okay, but could you tell me more why they are concerned about you? Why
Because we've got all this arguing. They want to control my life, and I want to control what I do, and I want to control what I eat and what I do with my time. And they go on about eating together, having meals, and I'm not interested in any of this nonsense.
Okay, I understand. They're very concerned about you, but I mean, you said they want to control your life. Could you tell me more how they are controlling your life, as for example, in your eating, in your
Oh yeah,
are
okay. If
going
you
on?
have to know, it's none of your business. By the way, how I live my life. But nevertheless, if you want to know, I'll tell you. I like routine and I like planning my
Yeah.
day. So I do a bit of exercise every day, and
Uh-huh.
prepare my own food. I'm vegetarian and I became vegan recently, and I try to control what I eat and what I do, and I concentrate on my studies. I'm university second year, so I've got a lot of work, and you're wasting your time
Oh.
with me.
I appreciate you are here and you're doing a good lifestyle. But can you tell me about your diet style? Which type of diet you are have? You said you have gone to vegan. So how you are managing your diet? You said you are cooking your diet by yourself. Can you tell me
But
more?
are you interested in what I eat on a daily basis,
Yes, definitely I am.
including all my meals and times?
Yes, definitely.
Okay, so I have my breakfast usually at 7 o'clock,
Mhm.
and at that stage I eat. I've got some. I eat half of a melon and usually 3 celery sticks,
Mhm.
and I've got some a few nuts, usually 4 or 5 nuts,
Mhm.
hazelnuts,
Mhm.
and I may have a bit of soya milk, something like 100 or 120 mils of soya milk.
Mhm.
And for lunch, I usually have a bit of a bit of celery again. I've got one medium-sized banana, and I've got 2 slices of bread, brown bread with vegan spread.
Okay. So do you always
And-
measure your calories?
And my
Yes,
supper is again. I try to cut down, but I take 2 biscuits, and I usually have 200 mils of soya milk.
Okay. So do you always measure your calorie, how much you are taking
Yes,
every
yes,
day?
it's very important for me.
Okay, I understand. And you said you are doing exercise. Can you tell me more about this?
About what?
Your
Exercise.
exercise.
So I normally I normally go swimming. So it's an hour of swimming in the morning, and by the end of the day, I may be doing a bit of a video exercise, 10 minutes, but it doesn't happen very often.
Okay, I understand. But you said you are measuring your calorie, you are doing exercises. Do, anything else which I have missed? And you said about your
Yes,
family
because my
members.
family is concerned about, I'm not very proud of that, but do you really want to know?
Yes,
All right.
please. Go ahead.
Because I'm not very proud and I'm quite embarrassed about it. That from time to time I give in, and there were times when I was eating this ridiculous. Oh, I just feel so revolted about it that I don't even want to talk about it. But there are times when somehow I eat all this terrible food, and I just feel so guilty and so ashamed of myself.
I mean, why do you feel guilty?
Because it's all this unhealthy and all this chocolate, and just don't even want to know about it.
Oh, I understand. But you are maintaining your diet, you are doing exercises. Why your families are concerned? Are you losing any weight? Do you
My
feel
family is concerned
ashamed?
because I'm losing weight, but it's not too concerning. But they are concerned about those times when I hide, and they notice that food missing and all those packages and all this vomiting. It's just so embarrassing. And but I have to stop it. I know I have to stop it, but it's hard.
Okay. So why you are feeling, do you feel you are overweight, anything like that?
At the moment, it's not an issue. I would probably, I'm 45 kilograms, and I thought I would be happy with 45, but I think maybe now 42 would be nice with my height. But I just have to stop this those episodes of eating.
Do you, do you have any friends with who you have discussed with these things? You are not overweight.
God, I would feel absolutely ashamed of that. So no, how can I? It means there is a blog, and I talk to other people on the blog,
Mm.
and there are other people having the same problem. but it stays in my mind. I cannot get rid of that because it stays in my mind that it's night when everybody goes to bed, and I already have hidden biscuits and chocolate under my bed, and it just plays on my mind that I have to have it, and I have it, and later I feel dreadful.
Okay, and what do you do after that?
That's even more embarrassing because I there is no other option because I just lose control over that, and I have to go to the toilet, and you know what happens in the toilet. I just throw up.
Okay, so that's why your families are very much concerned.
It means they don't know much about it because it's happening when they are away, and but yes.
Okay, all right. And how is it? How often you are having these problems? I mean, how long you're having this problem?
It means it has been going on for 6 months. I just tried once
Okay.
and vomiting, and knowing that I can lose all this food that I've eaten. It somehow came to my mind that I can eat whatever I want. So it's like a vicious circle, and the for the last 6 weeks. It was most of the days. The only days I didn't binge was when I had my mother sitting with me constantly and going through my room and removing all those foods, which I hate. And we argue a lot, and it's just endless vicious circle.
So let me discuss something else. How is your mood recently?
And I just hate myself for all of that, and I hate my family, and I cannot stand any of that. So it's not great, and I feel very irritable.
Okay. Do you think you need help from us?
No, because you can't do anything about it, and I have to stop it myself. I think the time is coming. The time is up. Yes.
Yes.
We've got another few minutes. Thank you very much. So that would be. But I just wanted to. It's more difficult to interview somebody with bulimia. But I just wanted to tell you the most typical characteristics of binge eating. What did you figure out from my behavior? What are the most typical behaviors about it? Yes. So, or maybe I'll just tell you because otherwise we'll be guessing, and we've got another 2 minutes. So it's usually happening. As I said, and they are planning it, and it's placed on their mind over and over again, and it's usually planned, premeditated. So that's the first one. The second one is it involves usually all those foods which are normally regarded as unsafe. So some kind of junk food, high calories, high glycemic index. And normally they would be avoiding. Normally they are into healthy eating and all the rest of that. So the types of food which they normally don't have, and it's usually done nearly always done in secrecy. So it could be car, could be office somewhere, could be family going to bed, and they are doing it of their own. And very typically, they will say that they feel compelled to do that. They cannot stop, and there is a subjective sense of losing control. That's very important because they usually say that I've got when I start, I'm just people may be consuming the whole loaf of bread and 2 bars of chocolate, and they know immediately that they are going to feel guilty about it. So this immense feeling of guilt makes them to throw up, and that would be the typical binge. I was probably a bit too upfront because I didn't want to make it too complicated, but
in normal circumstances, it's a bit more hidden, but weight is less of an issue. Dieting is less of an issue. It usually develops in the context of anorexia nervosa, but there is more emotional instability and more personality disorder in case of bulimia nervosa. But there are those typical binges, and if you are doing OSCE, it's less likely than anorexia, but you have to find out the frequency, secrecy, types of food, and what they do after that. If you do that, it will be a plus on those normal anorexic questions. Okay, the time is up. Do you have any questions? Sorry, it wasn't too high. I wanted it because of technical problems. Yes, please.
So bulimia, is it characterized by the purging or a combination of things? So, for example, you see a patient who has anorexia.
Yes.
But they also purge as well. Do they have?
Yes, they've got if that's the case, they've got anorexia nervosa unrestrictive or non-restrictive type, which is complicated by binging. But if there are no prominent anorexic symptoms and they are mostly binging, it becomes a binge eating disorder. So they are not significantly underweight. They don't have those anorexic body image distortions. They don't count calories. They are just and it develops mostly in the context of a personality disorder. It develops far more often in the context of internal psychological unresolved conflicts. So whether there was some abuse, exploitation, neglect, abandonment, something like that is far more common. And bulimia nervosa is typically very difficult to treat, and they are very resistant to treatment. And it requires both anorexia and bulimia. It requires those enormous motivation and determination and this kind of supreme motivation to overcome those behaviors. But bulimia, they will typically it goes on and rarely, in about I would say less than 50%, it comes to any kind of resolution if it is there for more than 6 months. So if you've got a patient with bulimia for more than 6 months, it's unlikely that it will be resolved. It may, so we try to treat them to decrease the amount of the number of binges, the circumstances, and we are trying sometimes delay between. Because it's like they eat, they have all this chocolate and all this hidden food, and they eat all of that, and there's this moment when they know that there's yet another bite of chocolate, they will be vomiting. So because of that, it doesn't matter what they consume, and they lose control, and they have all of that. There's this critical moment which makes them losing control, and very often they will be referring to, I have no control, it's on my mind, it's a compulsion, I'll be having, no matter what you say, I know all of that. Yes, and very often you examine them, they've got electrolyte imbalance. Very often they've got those signs on their knuckles, but after some time, the vomiting is spontaneous. They think about it, and it comes spontaneously. Please do ask questions if you have. But please do remember that coming across anorexia